Schizophrenia is a chronic psychosis that affects the development of the nervous system, characterized by a severe mental disorder, altering perception or contact with reality. It presents a male predominance and mainly affects adolescents and young adults aged 15 to 30 years old. The diagnosis of schizophrenia relies on triad symptoms or syndromes. The positive syndrome or delusional and hallucinatory syndrome is one of the three main symptoms of schizophrenia. It is characterized by the presence of delusional ideas and hallucinations.
Delusions and hallucinations.
Delusional ideas are false beliefs that persist despite evidence to the contrary. They can be varied and involve a loss of contact with reality. For example, a schizophrenic person may believe they are being persecuted or are controlled by an external forces.
That someone is watching me.
Hallucinations are sensory perceptions that occur in the absence of corresponding external stimuli. The most common hallucinations in schizophrenia are auditory hallucinations, where the person hears voices speaking or commenting on their actions. However, hallucination can also affect other senses such as sight, touch, or smell. The second syndrome, or the dissociative syndrome, also known as disorganization syndrome, is another important aspect of schizophrenia. It is characterized by a disturbance of a psychic unity between the person's ideas, affects, and attitudes. This disturbance can manifest in various ways. For example, the schizophrenic person might have difficulty organizing their thoughts currently or expressing their emotions appropriately. They may also exhibit disorganized or inconsistent behaviors in their social interactions. It is crucial to note that the presence of this syndrome alone is not sufficient to diagnose schizophrenia. This syndrome can also be observed in other psychiatric disorders, such as bipolar disorder with psychotic features, or even in non-psychiatric medical conditions. The third syndrome, which is the negative syndrome, also known as autistic withdrawal, is another clinical aspect of schizophrenia. It is characterized by a decrease or absence of normal psychic functions, affecting the behavior and emotional functioning of the individual. Unlike depression, where emotions can be intense but generally negative, in schizophrenia, emotions may appear flat or inexpressive. Social withdrawal and familial isolation are common manifestations of the negative syndrome. The individual may tend to avoid social interactions, withdraw into their inner world, and experience difficulties in establishing and maintaining interpersonal relationships. Moreover, intense imaginary life and detachment from reality occur. They may retreat into internal thoughts or fantasies, which can contribute to their social isolation and difficulty functioning in the external world. These negative symptoms can have a significant impact on the quality of life of individuals with schizophrenia. Thanks for watching, and I'll see you in the management of schizophrenia.